Everybody, I'm Gwendolyn Sterk, and I'm here for our July 22 Not-for-Profit Hero of the Month. And today we're going to have the United Cerebral Palsy-Center for Disability Services with us, and our friend Mike Hennessy is able to join us today. So Mike, introduce yourself and tell us a little bit about what it is that you do first.
Well, thanks, Gwen, for this opportunity, and thanks again for everything you and your colleagues do to help our community. I've been with United Cerebral Palsy-Center for Disability Services almost 2 years as their executive director. The organization dates back to 1955 when it was formed by a gentleman by the name of Melvin J. Larson, who was a college professor at JJC and brought together a number of families who had children with cerebral palsy, but not sure where to go, needing services. And together, working with the Will County Health Department, they formed, which then was called United Cerebral Palsy of Will County. And then over the years, our name has changed. And of course, currently we're United Cerebral Palsy-Center for Disability Services. We're an affiliate of the National United Cerebral Palsy Association. And by the way, I used to work for them several years ago. And we serve 5 counties: Will, Grundy, Kendall, Kankakee, and Iroquois counties. And we've had a wonderful history of services to individuals and families with disabilities. We have 4 core programs currently. Our Melvin J. Larson School, of course, our school program was named in memory of Mel Larson. And we serve students from age 3 to 22 from local school districts, where we have an adult development training program, community-based program serving adults with disabilities. Majority of our adults come from 2 providers who have residential care for adults with disabilities: Easter Seals, the Joliet region, and Trinity Services. And we have 2 home-based programs, Family Support Home-Based, helping provide resources and support to families so the family unit can be maintained, and giving whatever resources they can to help their son or daughter with a disability. And then the 4th program is our in-home respite care program, which provides a break for families, providing a trained care worker to care for, could be more than one child with a disability, and the family members can take a break and do what they need to do to take care of themselves while someone is in the home caring for their son or daughter. Those are the 4 core programs. Physically, we're located, our adult program and our school program, our administrative offices, and then the offices for our family support and home base in the former Reachwood School building. Used to be with part of District 86. We're located at 311 South Reed Street. And this building was closed probably back in the early 80s. And then we had 2 facilities. One was called the Manhattan Road Center in Cherryville School. And then back in 1985, we consolidated and located here. In fact, just as an aside, I was the executive director back in 81 through 86 and was involved in helping to relocate our programs into our current center at 311 South Reed Street.
Wow, that's quite a history. And what's very fascinating to me is that you run all the ages. I mean, you're really there throughout someone's life, essentially. Yes. And then you're also there, whether it's in placement, placement services, or whether or not it's in home and giving the families respite. So what I'm always been impressed with is the variety of, time period that you're able to help and the family member support that you give as well.
Absolutely. Correct? That's correct, Gwen. It's a lifetime of care. Right. And all of it's interesting, the families that we're serving in our in-home respite program, they're not involved in either one of our day programs, not in children in our school program or adults in our adult program. Truly reaching out to other aspects of our community, provide that in-home respite care that families very much need. And we're always looking, as we have a great team members and board, looking at what other needs are there that families have that we can take a look at and perhaps expand into other services. Needless to say, the impact that COVID had over the last 2 years really had an impact on us and other providers. One of the challenges that we face, we couldn't go anywhere as staff, even though some things have been reduced. We have so many individuals who are very vulnerable and were not eligible for the vaccine back then. And we couldn't take any chance of bringing the virus back that would help complicate their life. And make things more challenging. But now we're on a new direction and we're able to open, and as Kelly experienced with Joliet Young Professionals with the Joliet Region Chamber of Commerce Industry, we're able to welcome volunteers back and provide opportunities to engage to help us fulfill our mission and learn more about what we're doing and support our work.
Right. So I wanted to talk about those two different varieties of people that might need, or want to have communication with you. So let's first deal with the family who has someone who needs your services. Where do they really start? I mean, a lot of times, just so you know, from our experience, people feel paralyzed and they feel like they just don't even know how to initiate the ask, right? Whatever that ask may be and whatever the options are. How does somebody start there?
They can just call us, 815-744-3500. They can send us an email, info@ucp-cds.org. That's one place to start. They can also, for students that's going through their school district, all the school district know us and can make appropriate referral. They can contact other nonprofit agencies. I mean, now we have 211 that just launched last month in our community through United Way of Will County, and that's a place to start. They would call and say, I have a son or daughter with a disability. Where can I go for help? And then our name would come up, and we get emails and calls all the time, and then we can take a look at, are we the appropriate agency to help them? And if not, we know who is and can make the appropriate referral. A lot of our referrals come from other family members or other families as a support group. They hear from that family member how the services UCP-CDS is provided, and they then reach out and inquire, what can we do?
Sure.
So those are some resources. Service Incorporated is another one where people reach out to Service Inc. to apply to get on their priority utilization list and look for placement, especially if the family is planning down the road, if they need residential care for their son or daughter or whatever other needs. So there's a variety of different ways. The main thing is either pick up the phone or send an email, and then we can help them and take it from there.
Right. And I think you would agree with me that, it really takes that first step, and then somebody's going to come alongside of you and kind of lead you through that process. And really, people just need to do that ask, because, that really is the first step. So if you're listening today and you know that this is something you're going to have to deal with, there can be a variety of reasons why people don't want to take those steps, but they really need to do that, and they need to persevere, because that's one of the things that can happen and can help you on a long-term basis, as you're hearing that the services are really lifelong and the condition is lifelong. So that's one way that people might want to get a hold of you. But the other is, Mike, there's a lot of people out there that say, look, we went through COVID. I really, went into myself, but now that we're back out, I want to start re-giving. I want to get involved in the community. What is it that an individual can do? How can we help? And where do we start?
Well, an individual, in terms of their philanthropic desires, helping families and children, adults with disabilities, we have a variety of ways where people can support us. In fact, on July 31st, we're having our second annual Great America Big Wheel contest. These are teams who compete among each other, very competitive, and it's a way to help raise funds in disability for UCP-CDS, and a way to connect individuals through us. We have an annual appeal, our Gridiron fundraising event that ties into the big game. We can't call it Super Bowl, but squares that are purchased, those are funds that can give, that can support us. And then we're going to have our 26th annual, we took a couple years off, our Great Chefs Tasting and Auction Party that usually is the first Sunday in March, and many people have connected with us through that. So there's a variety of ways that we can help. And besides giving of one's treasure, giving of one's time, now that we're welcoming back volunteers to come into our center, UCP-CDS has always been an area where companies, individual groups have team projects to help us, whether it's outside work or inside work to help us, painting, cleaning. In fact, a week from this Tuesday, on the 26th of July, July 26th is the 32nd anniversary of the Americans with Disabilities Act. and we're going to help celebrate the ADA. We have an adaptive playground, accessible playground that was built and dedicated back in 2013. And we did some upgrades and had a fence placed around it for safety for our students and adult clients. And so what we're going to do is have a little ribbon cutting ceremony at 10 o'clock on the 26th to again celebrate ADA and all the good things that are available and building on more that's available for persons with disabilities. So no matter what that interest is that individual would have, there's a variety of ways that they can get involved and help us.
Right. And where would they contact you in order to find out more, first of all, about what activities are coming up, or how they could get involved with a group or come in, do some paintings, provide services, whether it be their time or their assets?
The biggest, easiest way is through our website, UCP-CDS.org. Send us an email, info@UCP-CDS.org. They can call us at our main number, 815-744-3500, and we can begin the conversation to see what they're interested in, and then link them to appropriate program or an event that definitely will meet their needs. They're always looking at new and creative things. We got a great creative team to further engage people. I know when we talk to the young professionals, what are some of the things they would like to do, and look at team projects that can have. Of course, with graduation requirements now, we'll be able to get students back to do some volunteer hands-on work to meet their 40 hours. Of course, we couldn't do that with the pandemic, but that's another way. And then getting some of those young folks involved to help, and then maybe that might change their mind in terms of their career. One of the challenges, Gwen, that we face and other organizations face right now, continue to face, are staff. We have meeting our, what we call our direct service professionals. We have openings constantly, but we just can't get individuals. Our paraprofessionals, teachers, working with our students. We've been continuing to advertise, but we just can't get the individuals to apply. So that's another way too. We're hoping that we'll be able to get more individuals step up and fill the positions we have, and then help with any new referrals that may be coming our way.
Very good. Now, can you give us a little statistic, a little history about not just the services that you provide, but by the individuals? How many children and adults, individuals in our community really need your services?
The actual total number, I don't have that actual number. We're currently serving 33 students in our school program. Okay. We have about 34 in our adult program, a little over 100 in our family support and home-based program. And then we also have about a little over 30 families that we're serving in our in-home respite care program. And then, of course, we coordinate and network with other providers who serve children and adults with disabilities in our community as well. They may have residential care or other services, so we all complement each other. Typically, UCP-CDS has been an organization where we have individuals who are very physically challenged. We have several students who require a nurse with them 24/7. And when they're here the whole day, that nurse is with them, of course, working with the teacher and the paraprofessional, but because of their medical needs, they're very much in need of that ongoing medical care every hour that they're here.
Right, and I think that gives us a little insight, because but for the grace of God go I. And I think that if we are looking at it from that perspective, it also, gives us that passion to be able to help people who are challenged in this area.
Absolutely. Absolutely.
So now I'm very curious, and tell me a little more about this 211 number and that it's just passed. I think people really don't know much about it. So why don't we share that information?
Yeah, I mean, as you know, I used to be the president and CEO for United Way of Will County. And we had talked about a helpline number for many years. 211 is the national initiative that actually United Way of America played a role in creating. Illinois was behind in creating and developing a 211. We were very blessed for 40 plus years to have Crisis Line of Will County. Sister Mary Frances Seeley actually formed that. Our United Way of Will County supported Crisis Line of Will County, but then, and we had talked about converting to a 211, Crisis Line being the point agency to field those calls. But then about a year ago, I think it was November, unfortunately, crisis line needed closed. And so there was a gap. So that just made a emphasis for United Way of Will County to step up. And they're partnering with getting funding from the Will County Board. And 211 is now available. So when you dial 211, you'll receive a person who will answer your call. And then you'll be able to tell them what needs you have. They can explore what other challenges you may be facing. And then depending on the service that you're looking for, they have a list of agencies and they can drill down into a geographic area, even as close to a zip code area. I mean, for example, we knew that we can take a zip code. We happen to be in 60436 where we're physically located. And if I wanted a list of food pantries, of course, you can go online and do that, but you can talk to that 211 worker and they would, here's the list of pantries close to where you are, or organizations that are serving the homeless. And I know you're very involved with the Morningside Mission, Daybreak Center, whether it's also groundwork through Guardian Angel Community Services for domestic violence, individuals affected by domestic violence. So that 211 caregiver can then direct them to the appropriate agency and then make sure that they're connected. That's the other key thing, is make sure there's follow-through. It's one thing to provide a list of organizations, but make sure that they do follow through.
Sure.
And in some cases, I don't have all the specifics, and maybe when you have a chance to interview, if you haven't already, with Ms. Martinez with United Way of Will County, she can get into a little more specifics now that this has been launched a couple months ago. But it's a wonderful asset. Now, I think our whole state is now covered by a 211, which is what the goal was for Illinois, to be fully covered by 211. So that's usually for most communities, that's usually the entry point. And even if a family member lives out of state, they can find that 211 that where they're happy to be located and call on behalf of the family and then find out what's the agency that can meet their particular needs.
It's absolutely wonderful to get that community, kind of basis together, because there are so many wonderful organizations and people don't necessarily know about them either. So it is a good way to facilitate it. I do want to touch on one more thing before we wrap it up today, which is the importance of, you talked about the priority of urgency, the PUNS list that's out there. Right. So families that are in your community, they really need to get on that list and make sure that they're following through on it right away. Can you explain that list to our listener today and the importance of it?
The sooner the better. They need to contact Service Incorporated, and they can look online. I don't have the phone number right at my fingertips, but they do need to do that. The sooner the better, because that list can take years before an opening can come about. And so they need to then explore and talk with them. Service Inc. has their facilities right here in Joliet, and I'm sure they can set up an appointment with a caseworker and make sure that happens. I mean, we have some young families within our school program, so just planning ahead and making sure that their loved one is cared for, but they definitely need to do that. And of course, the key is availability of funding, and that's always a challenge, as we all know. No matter what the need is there enough financial resources to expand residential options or expand our adult day program, for example, provide more in-home based services? And the whole list goes, you can go through that whole list, but getting on that PUNS list is very, very important. But it's Service Inc. And so a family can just go online and type in Service Inc. They cover several counties, but they happen to be physically located here, office in Joliet.
Well, for those who are listening, you can tell that Mike is just full of information. I know that you are an absolute asset in our community, not just about the organization which you serve very well, but also just in general to help direct people as to where they need to go. Anything finally you'd like to say about the passion you have for the organization you currently are the executive director for?
Well, thanks again, Gwen, for this opportunity. UCP-CDS is very blessed with dedicated staff. We have staff members here that have been here over 30 years.
Wow.
So their commitment and dedication is second to none. And so we're very blessed. We're very blessed with wonderful supporters. Hopefully they'll be supporting our upcoming events to continue to fulfill our mission. Thanks to the good things that you and your firm do every day to help one another in our community. And we look forward to our continued partnership. I look forward to more ongoing dialogue. And anytime anyone would have a question, feel free to give me a call. I still stay in touch with a lot of nonprofit organizations. I still chair, by the way, the Will County Emergency Food and Shelter Program, which our county was very blessed to receive additional funding through the federal government to provide support to our shelters, provide food assistance, rent assistance, utility assistance. It was called Phase 39, but then also in the American Rescue Plan funds, that was additional funding available to make sure we were helping. In fact, we're staying in contact with our county. And as you know, the Will County Board has funds available that will be distributing for the American Rescue Plan. So we're anxiously awaiting where UCP-CDS and other comparable organizations may fall under to be able to apply, because that helps us with the COVID-related expenditures that we incurred. I mean, we were very blessed to get funding back from the CARES funding a little over a year ago, and we've been tracking those COVID-related costs. And so whatever the county can do, and even municipalities have received American Rescue Plan funds, and if some of that can be set aside for nonprofit organizations, that would be wonderful as well. So we appreciate all the opportunity, and we're very, very blessed with wonderful people who give their time to help one another, and hope more will continue to support all the good things UCP-CDS does.
Well, thank you so much for your time. We really appreciated learning more about your organization.
Well, thank you, Gwen. You have a wonderful day, and thanks for this opportunity. Take care.
Thank you.
See you.